We know that physicians coming into the healthcare workforce today, as is also a reflection more generally of their generation, they're going to have multiple different careers during one lifetime.
Stanford, perhaps because of geography and location, has been very willing to experiment with consumer tech companies. How are you thinking about access to technology? The fact that many of the patients that would most benefit from technology aren't necessarily the most tech savvy, might not be able to afford the technology. How does that come into play?
I think what we have to do is continue to focus on lowering the friction. What we know is that many wearables are worn for the first 3 to 4 months, and then they sit on the shelf. Now, we have faculty at Stanford that are looking at the development of a smart mirror. After all, you and I, every morning, at some point, we're looking in the mirror. There's a lot that can be determined based upon the image of our face. So how do we continue to embed measurements of our health, feedback on our health, in a completely non-obtrusive way into our lives? I think that's the ultimate key to getting greater adoption and greater impact of consumer-facing technologies in healthcare.
Let's talk about what it means for doctors. Have you started to think about how to embed some of these skills into your curriculum?
What we strive to achieve is to prepare people to be lifelong learners. The model, say, of 30, 40 years ago, where a person got out of school, began working for a company or a practice, and they stayed in that environment for 30 to 40 years, that model is rapidly disappearing. What I think will be the common denominator for most is that most people still are drawn to medicine because of the very special and unique relationship it allows human beings to have with one another. So I don't think that's going to go away. What I think we'll see is that maybe they don't want to do it 5 days a week, 50 weeks out of the year for 30 years. But what we want to do is prepare our students to have that type of mobility throughout their lives.
Can you give me an example, perhaps, of how the curriculum is changing? So, for example, when we surveyed physicians about a year ago, they told us that they don't learn business skills in medical school, and they wish they did. They don't necessarily learn the technology skills that they need, and they wish they did. If you looked at your curriculum maybe 10 years ago versus today, do you see that evolution happening?
Yes. Let me tell you about one course that we offer, both in combination with the Graduate School of Business. The course is called Difficult Conversations. Each year, we continue to increase the opportunities for students to enroll in that course, and we continue to see the demand go up as well.
So you said you've seen the trend of students wanting to take more business courses, more tech courses.
Yes, I think we have students every year that start companies. We have students that work, that take time off to work in the tech firms. And I think that's good. The vast majority of our students do residencies, and the vast majority practice medicine. But they do it in ways that may not have seemed standard, say, 5 to 10 years ago.
What can we do to get more medical students excited about something like primary care?
The model of the primary care physician is undergoing evolution, and there won't just be one model. One thing that we're trying to develop through Primary Care 2.0 and other similar initiatives is that the primary care physician will be interacting with, coordinating multiple different related healthcare professionals, such as lifestyle coaches, mental health care workers, dietitians, nutritionists. And the role of the primary care physician then is to be the coordinator for the entire care delivery experience and to be a leader and a manager of the healthcare delivery team.